Welcome to Direct Supply's webinar on ECG innovations in long-term care. The topic for today is the web-based ECG system from Spaulding Medical. My name is Brad Johansen, Program Consultant with Direct Supply, and I'll be moderating today's session. Please note, the information contained in this presentation is intended to provide general information, but not intended as legal or other advice. You should not act upon this information without first consulting with qualified healthcare and legal counsel. Today we are joined by two presenters. Amanda Baltz with Spaulding Medical. Amanda provides strategic guidance, manages partnerships, and drives future growth. Amanda is passionate about cardiac care and changing the world, one patient at a time. We're also joined by Rachel Rauwerdink, registered nurse and subacute manager with Cedar Community in West Bend, Wisconsin. Cedar Community is ranked among the nation's 100 largest nonprofit continuum of care providers. From homes and apartments for independent retirees to assisted living, short-term care, rehabilitation, skilled nursing, and memory loss services, Cedar Community's breadth of services ensures that residents have access to all levels of quality care. Thank you, ladies, for joining us. Now, please allow me to introduce our first speaker, Amanda Baltz with Spaulding Medical. Hi, Amanda.
Hi, Brad. Thanks for having me here today. As Brad mentioned, my name is Amanda Baltz, and I am the CEO for Spaulding Medical, where our mission is to bring quality cardiac care for anyone, anywhere. And we are also located here in Wisconsin. Spaulding Medical has partnered with Direct Supply to bring our novel 12-lead ECG solution into the long-term care markets. We are in the 2017 catalog, and we are being featured as really a marquee product in a much larger cardiac campaign, which is to bring additional cardiac solutions made and intended for long-term care to the long-term care space. So you'll see on our catalog page that you can purchase an entire kit, which would include our device, our tablet, carrying case, and accessories. And in a matter of several days, this package would be delivered to you, and within a few hours, you should be up and running and taking ECGs. So a little bit about Spaulding. Our background is that we've been in this market since 2011 with the Spaulding ECG. We've deployed this to many different countries, and it's been in use now since 2011 for the purpose of clinical research. So companies like Merck or Pfizer or Novartis have benefited from the ECG data that comes off of our equipment. And we purposely designed the solution to be extremely simple to use, but still maintaining very high quality data that is needed in order to make good decisions. So the way it was purposely designed was for people who may not necessarily have a lot of experience taking ECGs to be able to simply take an ECG, but for the physicians who need to see that high quality, they are still able to receive that. And as we were deploying this solution for clinical research, we really saw that there was an opportunity to take this solution into the healthcare markets. As you know, the number one cause of death is cardiac disease, and this problem is growing as the aging population is growing. The equipment and the systems needed to detect and support people with cardiac disease is typically very large equipment like you see on this slide here. And this equipment resides and is trapped in hospitals and clinics. And it's not just the equipment. The infrastructure that's needed to interpret the information coming from this equipment, the physicians, the cardiologists, they're also located within that hospital and clinic infrastructure. And so what Spaulding is really looking to do is we're really looking to release the technology from the hospitals and clinics and bring it into markets where patients who are really the most vulnerable have access to this technology. So in 5 simple steps, you can acquire a full interpreted 12-lead ECG and connect with a physician to provide a full interpretive ECG. And this whole process can take seconds to minutes. And this really rivals traditional systems where, dependent upon that infrastructure, you might be looking at hours to days before you would be receiving this information. So we're really excited about bringing this solution into long-term care. And I want to just highlight here that last year we ran a number of case studies, and one site in particular reported that they probably avoided 10 unnecessary hospital readmissions over 90 days by being able to take readings so quickly. And this is significant because this is a huge cost savings to this facilities. You know, we estimate over $100,000 that this saved this one facility alone. So with that, I would like to further introduce the Spaulding solution.
Imagine unlimited ECGs in the palm of your hand. A simple, modern approach to acquiring, analyzing, and storing ECGs is the mission of Spaulding Medical. Our innovative 12-lead ECG system integrates with your existing technology to make care and treatment decisions easier and faster. There are 4 building blocks to the Spaulding solution: device, apps, web ECG, and reader services. Working seamlessly together, they provide an ECG experience unlike any other. The Spaulding electrocardiograph is so small it fits in the palm of your hand. It is powered by a lithium-ion battery, so it is fully portable for continuous use for 3 to 4 hours. It is FDA cleared and CE approved. The device uses Bluetooth technology to wirelessly stream a 12-lead ECG to any mobile device or tablet. It can be used with any iOS, Android, or Windows device. The clinician connects the ECG cable to the device and checks the LED status window to verify that the P is in pairing mode. This means that the signal quality is good and you are ready to acquire the diagnostic 12-lead ECG data. In the upper corner, you will find a 10-second button and a rhythm button. The 10-second button allows you to record 10 seconds of an ECG. The rhythm button allows you to record up to 5 minutes of an ECG. The settings icon allows you to adjust the display on your screen. Press the 10-second button. The app will always record the previous 5 seconds and the next 5. Once the 10 seconds is up, you will either view or delete the ECG. Click View ECG Data to continue. Once you view the ECG, you will be prompted to enter in the patient demographic information. This information will either be populated ahead of time with the web ECG software, or you can simply enter it when you are with the patient. The demographic information is customizable, but at a minimum, you will need to record gender and the date of birth in order for the algorithm to provide an analysis on the ECG. Make sure to select Done to complete the demographic entry. Then click Save. Then Yes. Click Get Report in the upper right-hand corner to send to our cloud-based server for algorithm analysis. You'll see an icon appear that says Awaiting Report. This is also the moment in which your automated workflow is being enacted. Now you will see the report on your device. In the upper left-hand corner, you will see the demographic information. And in the upper right-hand corner, you will find the unconfirmed ECG interpretation. You can go back to take another ECG or move on to further workflow.
I'd like to now introduce Rachel Rauerdink, the subacute nurse manager at Cedar Community.
Thank you, Amanda, for that introduction. Like Amanda said, my name is Rachel Rauerdink. I am the nurse manager of a subacute rehab facility here in Wisconsin. Cedar Community is a 185-bed facility. We specialize in subacute rehab care as well as long-term care as a skilled nursing facility. I started using the Spaulding ECG machine in 2015, and really we fell in love with it, with the availability to really offer the best bedside care for our patients and the quick use of the ECG machine. So on this slide here, I listed some of the reasons why we chose Spaulding ECG machines. The first number one reason is ease of use. It's simple to hook up. You apply the electrodes to your patient, attach the leads to the Spaulding clinical ECG machine, and push on. And as simple as that, taking only minutes, you can start live streaming your data to your tablet or iPad. The ability to stream live ECG information and data really helps reduce the time frame to treat the patient most effectively. We're able to email that ECG data right over to the physician for him to assess that ECG information immediately. We also have had really good success with our nurse practitioners using the ECG machine at bedside and really diagnosing right at the bedside. Other reasons, easy 24-hour electronic access to the ECG data. Previous to being able to use the Spaulding ECG machine, we had to use a secondary provider. Often that secondary provider could take up to 24 to 48 hours before we could get an ECG done in our facility. That caused a delay in patient treatment. Often with a cardiac event, we didn't have that 24 hours or 48 hours to wait for that secondary provider. And so the ease of being able to grab the ECG machine and do an ECG immediately at bedside when needed is a huge savings, not only to the patient for time, but also for life-saving. Device portability, I just want to, from a clinical standpoint, just want to show everybody how truly small and condensed this ECG machine is. If you worked in a nursing home before, you probably are more familiar with the 4 wheels that you had to push to the patient's room, often having to bleach wipe it all down, and the infection control kind of footprint of that was very not conducive for the resident or for the staff. So it's truly a very small device, leaving a very small footprint, accessing the patient's rooms. And then lastly, the customer support. We were able to train our staff really quickly. We used it within the next 24 hours after training, and anytime needing any service help or any questions, we've been able to call Spaulding, and I can honestly say we really haven't had too many problems that we've ever had to call the service department. So. Use case summary. So at Cedar Lake, at our 185-bed facility, we do have 2 units that we utilize, and there are times that we have utilized both of those units at the same time. Some of the things that we use most often for is the pre-op evaluation. Not only does this help the patient not to have to go out for another a drive to the clinic to get labs done or to get their ECG, we can do it right in the facility. We can get their labs and their ECG at bedside where the patient is most comfortable, so that when they need to go out for a surgical procedure, everything can be done in-house. Other ways that we've used it is monitoring prolonged QT assessment, medication management. With so many medications that interact with cardiac, we do find that a lot of times we're able to keep patients on the antibiotics that they need to be on, or sometimes it's an antidepressant, on those medications, and just really give the patient and the doctor peace of mind that we're able to monitor them at the bedside and really giving them the best quality, being able to give them the best medications that they need, that the physician wants, and having that oversight of the ECG machine. We've also used it in pacemaker assessments. We've had on several occasions where the pacemaker is not working the way the cardiologist wants, or perhaps the patient feels that the pacemaker is not responding the way it normally does. We've used it in those assessments as well, and the cardiologists are able to read that data immediately. And then last but not least, probably the largest impact for long-term care is the change in condition for a patient, and really identifying the true cardiac events versus the non-cardiac events, and looking at the cost savings for not sending a patient out for a non-cardiac event when we're able to do the ECG at bedside and really give the doctors the best up-to-date ECG data so they can make the best determination if the the patient can stay and then we can manage them in long-term care, or if the patient needs a more acute setting. So some of the ways that the ECG machine from Spaulding has really helped us is with workflow changes. And some of those have really impacted our costs and our outcomes, and also for patient satisfaction. Some of those ways I just listed below were the availability to immediately live stream the ECG data onto our laptop. This has really helped. We do have several nurse practitioners in a house, and being able to stream that data live, they're able to stand in the hallway or even in the room and be able to assess the patient for the best patient outcome. Also, sending the physicians the data, we're able to send it via email. The doctor is able to see it in clinic on their cell phone. We have had doctors that have done it on vacation. They've been out on their boat and willing to view it on their phone, as well as being able to use the cloud. And so that's really changed because it used to be that we'd have to wait for a different provider to come, do the ECG, then we have to wait for them to read it, then we'd have to get it to the physician. And so this is a lot faster, gives the best patient outcome for the patients, and also helps us come up with a plan that best suits the patient and their medical needs. We've also been able to eliminate ECG scanning and faxing to physicians, and truly the faxing to the physician of the ECG machine has never really been good. It is not a good way to read an ECG, is a faxed copy, and so a lot of our physicians have really been happy that we have gone to a more technology advanced ECG machine that can be read a lot easier. And then time and cost reduction. Like I had said earlier, the time frame when a person is having a cardiac event, the availability to, within minutes, with the Spaulding ECG machine, apply the ECG, have live data, be able to send that to the physician. The time has been reduced dramatically with the Spaulding ECG. And also the cost of preventing some of those rehospitalizations has helped as well. I did just want to share a story that I had. One of my patients about 6 months ago, we'll say his name is Tom for all intents and purposes. He had been complaining of some chest pain, or some shortness of breath, excuse me. He didn't really make much of it. He had said that he felt like he felt pretty good. He was just tired, that he had struggled with some shortness of breath in the past, and that he thought we were kind of over-exaggerating the concern. The physician knew that we had the Spaulding ECG machine, asked for us to complete an ECG and send it over to him, and we were able to do that in minutes. We were able to identify that the patient was in AFib with RVR. The patient, with that information, we were able to give the patient the information and encourage him to go to the hospital, as that was a new cardiac rhythm for him. The patient did end up going to the hospital, was found to have bilateral pulmonary emboli, and actually it was the ER doctor that called us and thanked us for how quickly we got the ECG done and how quickly we convinced him to go to the hospital, and actually thanked us because we probably did save his life. So just one of the many stories of the ECG machine and how we've seen it used in our facility. And then just a couple of the last ways of the impact on cost, outcomes, and patient satisfaction is the reduce, like I said, an unnecessary transport of patient to the hospital for non-cardiac events. We, a lot of times, being able to do the ECG at bedside, able to calm patients and families' mind that is not a cardiac event when we're able to find a normal sinus rhythm, and prevent any of those unnecessary hospitalizations, because the more that you can do at a patient's bedside and the more information you can give to a doctor, the better chance that the patient will get the best outcome. And we've just really seen this in reducing non-cardiac events. Also, just reducing rehospitalization rates as we continue to, as the government is working towards fines for the hospitals for rehospitalization with an average cost of $11,000. We've really found that having the ECG and being able to use that and give the doctors and nurse practitioners the best information to make their decisions has dramatically improved our rehospitalization rate. And lastly, probably the most important, patients, they can remain in their most comfortable environment. Most patients don't want to go to the hospital if they don't have to. The cost is a lot for them. The transport isn't ideal as well. And so a lot of the patients being able to remain in a comfortable environment and have their ECG done right there and identify that there is no problem is a huge thing for our patients. And the other thing from a Cedar community standpoint is we really like having the Spaulding ECG because it puts us a step above a lot of our competitors, being able to assure the physicians when they send us their patients that we're able to take care of them, and that the Spaulding ECG is one of those cutting edge devices that we have that we can use on patients and really provide the best patient care with the best patient outcomes. So with all that being said, Cedar Community is happy to be working with Spaulding ECG, and it is really truly a great ECG solution in a small package.
Rachel, thank you so much for that wonderful content and feedback. We received a few questions for you from the folks online. You mentioned some of your physician feedback, and there were questions around any tips for getting local physicians involved up front when you first adopted this. How did you present this to them, and how did you get them on board with the workflow?
Yeah, once we just made physicians aware that we had this new technology, a lot of them kind of spoke to each other. We found out a lot of the doctors were talking and were very happy that we had the Spaulding ECG and that we were able to do it. So we did talk to our medical director. He did bring it up in a couple of the meetings through Aurora and West Bend Clinic, and they pretty much spread the word for themselves once they knew. A lot of times asking for us to do a lot of the pre-op work in the nursing home so the patient doesn't have that unnecessary travel expense.
Great. Another question. How long did it take you to get implemented after you received the device? So once it was in-house, how long did it take you to feel comfortable using it on a regular basis?
We felt very comfortable after the training. I would say I know that we used it within the first week that we got the ECG machine and felt very confident. We have a binder that has all the information that Spaulding Clinical has in their information, and we're able to apply to patients very easily, feeling very confident, especially because the ECG data is such high quality. Our physicians are very happy with it, and so then we know that everybody is applying it and it's doing very well.
Great. When you have new staff come in, how do you train new staff on the device?
New staff, we typically do where they just watch us one time and then we watch them conduct an ECG. Like I said, we do have a binder. It's very quick and easy. Any nursing that has, gone through anatomy and physiology, it's a very easy device to apply. So just some over, supervision a little bit for the first time applying it, and then typically they're able to do it themselves after that. It's very easy.
Great. And final question for now is, what role did your IT team play in the implementation?
Yeah, our IT team did not really have to play a very large role at all. It was very simple. Again, pretty much anything with the ECG machine was simple. They just had to put our iPad, get that connected to our Wi-Fi at the facility, and we haven't had any problems since. So IT was just getting us connected to the internet. That's it.
All right. Well, thank you so much, and thank you, everyone, for your questions. Please continue to send them through. And at this point, we'll turn it back over to Amanda to talk about the future of Spaulding Medical and some of the new innovations coming down the road.
Thank you, Brad. So One thing that Rachel mentioned is that the kit does come with your standard 12-lead ECG hookup. And that's fine. You can do that. This is something that we are introducing, though, that we're really seeing that sometimes having something more standardized and having something that is more easy in terms of putting the electrodes on has been a request from our customers. So we've partnered with a company that has a solution called the EKG glove, and it's as simple as placing your hand in this this plastic glove-like. And what you do is you basically peel this sticker off the back, and the full electrode set is pre-printed here on the back of the glove. The limb leads are on the front, and those can simply just come up and be extended to the limb leads. This whole solution basically then gets applied to the patient's chest, and you would have your full 12-lead hookup done within a matter of seconds. So this is something that, in terms of hearing from a number of different long-term care customers, that having a solution that helps standardize the way that your staff takes ECGs is something that we were committed to finding a solution for. And here you can just see a diagram of what I just walked us through, but you can really see that the Spaulding device basically just has a connector cable to that glove, and again, it's just a very simple application. Any staff at any skilled level can then put the 12-lead application on the patient. We are also very, very committed, as I've mentioned, to really looking at ways to help avoid unnecessary hospitalizations. And this is something that when we're looking at how to solve solutions for long-term care, providing that information to your care teams to really help manage that cardiac patient in-house is really at the forefront of where our innovation is focused. So when we look at ways to improve upon the current solution, it really comes down to continuous platform development. Our mobile apps, our web-based software is where we will spend a lot of focus in terms of improving user interface experiences, providing additional report capabilities. But what this means is that when you buy the product, you're not necessarily having to replace the device itself. The updates are going to be basically pushed through your software, and you won't have to do anything. So, of course, improved ECG workflows, how we route ECGs, making sure that that's optimized for your care environment is also something that we're very focused on. And this also comes down to connectivity with EHRs or EMRs, and this is something that our technology team is working on right now. I mentioned reporting and data analysis capabilities, as well as design and user experience improvements.
This concludes our presentation today. So thank you again so much, everyone, for your time, and have a wonderful day.